attending our third and final Toolkit Set Learning session funded by the HCCN grant. So we have Shelby Cobes with us today. He has put together a toolkit of templates for health centers for responding to cybersecurity incidents. And that includes templates for incident response, business continuity, business impact analysis, crisis communications plan, and security risk analysis information. So today we'll be going over the business continuity template. And that toolkit is available on our website, and we'll also post the link in the chat of this meeting. So when you go to the website to access the toolkit, it will ask you to sign up and make a profile on the CHCANYS website, and that's because the toolkit is just for health center access. And we'll also send it out after the meeting. And Shelby will also discuss ransomware in today's presentation for a little bit. So feel free to ask questions at any point. And if you haven't attended one of these learning sessions before, just a little background on Shelby. He's a senior consultant in online healthcare practice, so in the risk, security, and privacy practice. He has extensive technical experience in the security industry, extensive experience with securing different devices to improve patient outcomes and reduce security incidents. And in addition to presenting at these learning sessions, he's also available for individual assistance. So if you want to tailor the templates to your health center, we will post a link to request technical assistance in the chat, and that will also be sent around after the meeting. So I think that's all you need to know from me. Shelby, the slides look good, so I think I'll hand it over to you.
You can see the actual slideshow presentation
looks
the presenter view. Okay, good. I just switched the way I was doing things here. So now I'm going to be looking at this side instead of looking at, I have two monitors. All right, hello everybody. Thanks for attending. I kind of run these in a way that if you guys ask questions, please feel free to talk. I don't want this to be just me presenting. This is an open forum to kind of walk through this and to kind of talk through these things. The idea is that I present something that kind of update on ransomware this time, and then go in and talk a little bit about business continuity plan, and I'll tie the two together and why I'm talking about ransomware during business continuity, because you might think, why am I talking about ransomware? But if you have any questions, please feel free to speak up. You're not interrupting me in any way. And so if you have any questions, please speak up. We can talk about it. This is what this is designed for. And so just to go through this really quick, I'm not going to spend a lot of time on ransomware, and then we'll go through, see here, there we go. Hey, I didn't even know I did transitions. So basically we're going to just quickly review ransomware, talk a little bit about business continuity, and go and how it's designed. Not going to go into a lot of that. This isn't really designed to give you what business continuity plans are, spiel. That's not what this time is for. I'm pretty sure you guys all know what they are anyway. But we'll just do a brief overview on basically why and what you need in a business continuity plan. Then we'll look at the template, and we'll go through the template, and we'll talk about what's in the template, what you guys need to add to the template, and then how we can tailor that to make it better. Okay, so let's talk just a little bit briefly about ransomware and what's going on. So recently, with the pipeline being ransomed and a lot of different ransomwares going on, you know, we all kind of know what ransomware is and what it can do to our organization. And so one of the things that I wanted to put together for you guys, and we'll send this out, is, you know, what are the things, you know, what we're good about addressing some of in our business continuity plans, some of the major risks out there, but putting IT risks and IT situations into our business continuity plans is kind of new. And I don't see it very often. I've looked at over 100 or so business continuity plans for 100 different healthcare clinics across Montana, Wyoming, West Virginia, and New York now. And a lot of times I see just basic business continuity plans, but nothing that really drills down and looks at what happens if there's a real issue with like ransomware or IT outage or anything like that. So just a quick definition of ransomware. I'm not going to go in. I'm not going to read the slides to you. And so on the bottom here, there is a HHS government gov site that also talks about it. This is a good link. I just put it up there just a few minutes ago to make sure that it was still active. Some of those government links switch around quite a bit, but that one still works. That's a great document that you can go to, and you'll have that when I send this out. So what do you do if you get ransomware? So I kind of put this stage checklist together for everybody, and you guys will also have this. And so some of the things that stick out right away, and I've taken this not only from some different documents out there, but also from a few times ago, like last year about this same time, we had somebody come on and talk to you guys about, talk to everybody about a clinic that was ransomware in your area. I can't remember the person's name or what clinic it was. Maybe Claire or Avery remember who that was. But some of the information I also took from an actual case and a couple actual cases that we've worked with different clients. And so response one is mitigate and remediate. And basically this is you know, what do you do right away when you see ransomware on your systems? And if you step down, there's kind of a checklist. You know, make sure you contact your security incident response team and your business continuity team. You know, make sure you unplug the computer and turn off the wireless function. But what I thought was interesting, and I found this in a few places, is that they don't want you to turn the computer off because there might be data they want you to disconnect it and make sure that it's not propagating anywhere, but they don't want you to actually turn the machine off because it might be, and when it comes back on, it might be locked and you might not be able to get the information, or it might do something when it turns back on, or it might fry it or kill it or something like that. But there's information on there that that might need to be required either by your insurance company or forensics or anything like that to figure out what type of ransomware is on there. Step two, determine the scope of the infection. Basically, this walks through, you know, what do I need to look at in my environment to figure out if ransomware is in other areas? You know, is the ransom file located in other areas of the system? Is it located out on my Dropboxes or in my Google Drive? Is it in my OneDrive? And so basically this is saying, you know, find a good non-infected computer and start looking for where else it might be located on your system and start doing that search. And again, if you've contacted your cyber insurance, they might have somebody that will come and help you with this, or they might have specific forensic information that you need to collect during this phase. So it's very good to connect with authorities right away and make sure that you're collecting the proper data that you need to collect. Okay, and to move to the next, step three. Now I put this on there, I've seen this, but this is more for advanced skill people who really know what they're doing, is to try to identify what ransomware it is. There are websites out there where you can do that. I would suggest being very careful at this point. If you start looking around for ransomware, you might find ransomware. So probably best off for your information security people, or your insurance people or your forensics people. This is part of their job, to figure out what you have and how far it's infected in there. And then step four is determine the response. We were just going over the pipeline information, and there's a report out there that they knew that they were going to pay the like $4 or $5 million within the first 24 hours of the ransomware being implemented into the system. Now it seems a little quick, but that was a pretty big pipeline, and they must have known right away that they either weren't covering their grounds good enough to know, or didn't have security controls in place to understand the complexity of the attack. And so they knew right away that they had to pay the ransom for this instead of try to restore. But again, in your response, this is where having, whoops, sorry. This is where, getting ahead of myself. This is where having good backups and part of your business continuity, good backups and testing those restores to making sure that you can restore and get things back running within a certain amount of time, and it's going to work for you. A lot of people back stuff up, and there's many times I've run into situations where, oh yeah, we back up nightly. And then the next question is, well, have you ever tested those backups? And then, about 50% of the time people say, well, no, we haven't actually done a restore. It's good to go through and actually do a restore, make sure things work, make sure copies come back, because sometimes they don't work the way you think they should work. So I put all that together into a couple slides. And this is basically, the next two slides are just basically, what do we need to do for our organization for ransomware? And I just kind of broke this up. This is something that I pulled from many different conversations that I had. And through awareness, we need to have a pretty robust phishing campaign going on in your organization. We have to really start training people on what's phishing, what it looks like, what the effects are if we click on it. Very targeted campaigns. I don't suggest kind of the reprimand model, where if you send out a fancy phishing email and somebody clicks on it and then they're reprimanded for doing that, because I don't think that's a very good way to get people to act appropriately if they do that. But just to have that data and to know where we need to target is more for what those are used for training. And I put a couple sites. Phishing Box is a new one that I've just started looking at. If you want more information about Phishing Box, I can probably get that information. There's a kind of a reduced price for that one. And then Phishing Insights by Trend Micro. They might even have a basic level free program there. But yeah, they do a lot of good things. And then some training and constant training. Different ways of monitoring, lots of monitoring what is outgoing, what type of things are being sent out of your network, if you have that ability. User interfaces. And one of the things that make sure your USB drives are locked. A lot of USB drives allow a lot of different devices into them. So it's good for that. I'm looking for a certain one I had on here, sorry. And then perimeter. And I just highlighted this one in red because it's come up in the last week 3 or 4 times for me. And that is work from home policy and procedures. A lot of us in 2020, 2021, our environment's changed. A lot of people are now working from home or are getting into our environment from home. And so we really need to rethink what that work from home policy looks like. And I might even put up, I'll talk to Avery and Claire about this, that might be something that we want to put up on the share folder for a sample. I have a couple that I'm working on right now, but definitely things have changed there, and that remote access into your EMR and EHR systems. And this is maybe some technical fixes for it that I put together. Again, it kind of some of it overlaps. Things I've highlighted in blue that are new that we maybe need to look at enhancing a little bit in our organizations. Third-party accounts to make sure old accounts are not active. This has gotten a few people in our group of clients that we work with, is making sure all third-party accounts are terminated upon termination. Sometimes there's financial software, different types of software out there that require you to go in and make sure that those things are terminated. And those old accounts can sit there and eventually they can be compromised, and it gives people a way in. So definitely a termination checklist when people are removed from your environment. Work at home policy, I just said that. And then limiting access to your EMR systems. A lot of places have full access 24 hours, and they haven't looked at, okay, so if you're only open from 6 in the morning to 8 at night, there's maybe only 80% of your people that might need access during that time. And then there maybe is only 20% of your people that might need access to your EMR after work hours. And that after a certain time that should be that from 8 o'clock at night until 5 in the morning, those people don't have access. And so now you're limiting just to a few people that have access into your network. And so it's much easier to monitor a few people coming into your network than it is monitoring 100 or 200 people coming into your network at any given time. So this is something that I've seen more and more being done, but definitely there are people and areas that just still allow everybody in at all time. And then this is where it links into the business continuity plan. We need to have specific plans and incident response for ransomware in your business continuity plan. This is how we deal with it. This is how we're going to deal with it. Here's the steps. And it needs to be listed out in your business continuity plan because it can take you down just as fast as any fire or any tornado or any other natural disaster out there. A ransomware attack can be quite critical to an organization. It can take them down for a very long time. All right, do we have any questions? I know I'm going fast. I go fast and then give people time back in their day. If you have any questions, please speak up. All right, moving on. No, wrong way. So business continuity. Let's get into that a little bit now. What do we have for you guys? So just to review, why do we need business continuity? Ransomware and cybersecurity threats. Keep your business objectives moving, and make sure that your objectives in your organization are met. Patient safety, keep your finances up and running. And it's required by HIPAA to have a business continuity plan. And obviously, it's just good business. We need to make sure that in an event of an emergency, that especially hospitals and medical facilities, it's just good business and good patients and good safety for your patient to have a good business continuity plan. Same idea, what might, don't go on. What are some things that might be in your business continuity? What are some things that could bring your business down? Any one of these things could bring your business down at any given time. 2 years ago, we would have never even thought about pandemic, but now it's front and center in all business continuity plans. And again, social political conflicts are coming up more and more. I've been into a lot of clinics that they might have located one of their buildings in a mall complex. And during the riots and some of the riot, they were shut down because they couldn't get to their facility, or there was a fire right next to them due to it. So it's something to think about now. And then the obvious power outages and natural disasters. And yes, it is required by HIPAA to have a business continuity plan in place and a disaster recovery and a way to back up your systems. Those are actually required elements of business continuity. I have that right here. So your data backup plan, disaster recovery plan, and emergency operation mode, these are all required. So you have to have those in place. If you have an audit or risk assessment and you don't have those, they will definitely write a plan for you to have those in place. Okay, so when I developed the business continuity plan that you guys will see pretty soon, I based it off the NYS framework of recovery, identify, protect, detect, response. I'm not going to go into this too much. It's pretty standard NYS cybersecurity framework. But these are the areas, and if you want to go in depth and learn more about that, you can go to this site and you can pull up the, I don't know the exact document on it. I'll have to get the 850 something or whatever it is framework, but it basically gives you ideas here, you know, recover just over here, you know, what do you need to do under protect, the questions you need to answer, how will you maintain integrity of your information, and then different controls. So when I designed the actual template, I went off this model, basically because it's widely used and it's a good one and it's what our government uses. So I just kind of focused on that. All right, so let's take a peek really quick at the template here. I'll have to unshare this here and reshare. All right. All right, you guys seeing that okay? Ready to zoom in?
Yeah, we see it.
All right.
That's good.
So this is the business continuity template that we have. And so one of the things that I when I'm working with business continuity templates, this is, of all the policies out there, probably the most flexible and customized template out there, meaning that in order for it needs to really be your document and a document that you work on and kind of goes through a maturity cycle and an enhancement and year after year and building on building on building, because it's very specific to your organization. It's hard to make a template that is very specific to your organization. So what I've done here, and it's things to know, is this is just general scoping and purpose language. That's pretty general information. But when you get into your objectives, these are really going to be your objectives. And so this is suggested objectives, but you need to look and if you don't have one, you probably, and if you do have one, you can kind of compare what's in here to what yours is. But you know, this might be something that's, it needs to be 1 day, or needs to be 20 minutes, or needs to be, depending on how critical patients that you have in your organization. You know, some organizations I've been in and done this, their downtime has to be almost zero. So, because they don't really have, they have a lot of people on life support, and so their ability to, if there's an incident, to flex and to move their systems and to make sure that things are hot and there's no real downtime is very important. Now for some people, having a day down isn't that critical. You just won't be able to see people, but you need to be up and running in order to make money and to keep your business running and to meet patients and people's needs. So that needs to be looked at right there. Now, a lot of the first part of this is organization of your team. So who's going to be on your team? Who's going to basically control things as incidents happen? So there's a couple layers, and sometimes I always tell people, in small organizations, these teams are going to overlap. You're not going to have a complete different leadership team than maybe your incident, than maybe your business continuity team from a ground team. They're going to overlap at some time. And these are just suggested title names that are in there. You will probably call things differently in your organization, or you might have a CIO/CFO, or you might have, you know, different people for different organizations. The idea here isn't necessarily these certain people. The idea is that you have a team, and you have a management team, the team that's going to make the decision. Do we need to activate the business continuity plan? How is this going to work, and things like that. The next level of team is the middle level team. This team is more of the type of people in your organization that people look to for information. So these people are making the decisions. these people here are going to maybe communicate those decisions out. So it might be operations, HR, it might be your head nursing, it might be your lead doctors on this team, but they're not going to be in every meeting when it comes to how to plan this stuff. The planning goes on up here. So, but in small organizations, obviously, these teams are going to overlap. And they may overlap. And then the ground team is basically who in the organization are your boots on the ground. You want to designate maybe a few people to help out on the ground in case of an emergency. You know, there might be 2 or 3 people, 2 or 3 nurses, maybe somebody in human resources that could also be the ground team. Again, these might overlap. You're calling them out because what happens in the plan as you get down into the plan is different people need to do different things. And in the case of an emergency, you need to spread it out and make sure things happen quickly and understand who these people are and how to communicate to them. Okay. Locations, don't need to talk about that. Alternative locations. It's good to have an alternative locations in case your building is not being used. I know in New York that can be difficult. In smaller town, United States, that's easy. It's normally the high school or middle school or someplace like that. A lot of times in your guys' situation, it's an alternate building that's, you know, a few miles away. Then to start identifying vital records in your organization. If there is a outage, what needs to also come with you if there's a problem? What files, what electronic charts, what EMR, well, those are records, so I don't know if EMR would be on there, but is there certain procedures, policies, documents that you need to have access to? You know, HR documents could be here. You know, communications could be in there. But you need to not only have those available, what are they and where are they located at? If it's digital on a shared drive, you know, the problem with that is if everything gets ransomware, how do you get to it? You know, so there might be some things that you need to think about when it comes to how you get to that information and where you get to that information. Vendor information. These are just random vendors in here just to show what goes in here. There might be a few vendors you need, radiology, to set up radiology if you have that. Maybe you don't have many vendors. Maybe you need your EMR vendor on there. If you're on ECW or Athena or eClinic, I said eClinical Works or Epic, maybe a good idea to have that contact on here, especially in case of ransomware. Again, what softwares need to be up and running, and then how quickly can you get that up and running? Again, and then this is going to be very, very customized to your organization. Recovery procedures. But I put some in here. This is a standard recovery procedure. Again, this team up in the top, your leadership team, will look through this and they will make decisions on what needs to additionally be in here. Any department level business continuity plans. In small healthcare clinics, there isn't a lot of those, but you might have a radiology department that needs a specific plan for themselves. You might have a dental facility that needs a specific plan for themselves, or you know, so it's good to think through what do we absolutely have to have in the case we need to set up a new shop. And if there are any specific things that are unique to our organization that we need to have. Now this is important here. When we do a risk assessment, it's important to add additional things in here, like how often have you tried this? What's your testing procedure on this? Is it a yearly test? Do we test the backup? How often is it backed up? You want a little more detail on here. You probably have a whole policy or procedure on backup, policy and procedure. You can link to that just specifically if you don't want it to have in here. But it's best probably just to put it in here. Then when you go through an audit, your auditors can see it. Business risk, and I'll talk about this more towards the bottom. So you want to go through and put in things into you. So the idea of a business continuity plan is to organize the team, but also to have specific plans in there. And some of the more mature ones that I see actually go through here and risk out and say, these are my top 10 or top 5 or 6 most likely risks to happen in the organization. Ransomware is going to be one. You know, the next one might be power outage. One of the places I just did a big risk assessment in a hospital in West Yellowstone, and their number 3 on their risk was massive earthquake. Something we don't think about, but in West Yellowstone, they have an earthquake almost every other day. So for them, they had a very sophisticated, here's how we respond to an earthquake and how to keep business running during an earthquake. So you need to go through and have those risks assessed. And then this is just testing, doing your tabletop test. This is also part of a HIPAA requirement. And I think we might have some tabletop test plan maybe for the end of this year or maybe the start of next year, but to actively know when, you know, annually, biannually, once every so often we do a tabletop test of one of our emergency response things, one of our processes to see if it's actually going to work and how we learn from that and how do we mature our process. So if we go down, so these are some of the hazards that I've seen in business continuity plans and have specific plans for. Ransomware, I don't see very much, but I am suggesting that everybody does that as probably one of the very high risks out there right now. And to know, and I'm actually developing kind of a checklist walkthrough for that, and that's part of those slides. I think what I'll do is I'll probably add that to the list of documents that you guys will have access to when I'm done with it, so that you guys have that to add to your plan. Do you guys have any questions? Let's talk this up. Again, it's a very customizable, very organization specific document. So please, if you have any questions, throw it out. It's a quiet group. I'm switching here. Anybody?
Shelby, this is Scott Kessler from Northampton Family Health Center. How are you?
Hi, Scott. How are you?
Fine, thank you. Thank you for presenting today. So for a lot of us, you know, in smaller health centers,
yeah.
Do you have some type of a top 5 kind of low-hanging fruit, if you will, document that you could share to help us decide where to start?
Yeah, so what I've been doing, and I've done this for about 2 or 3, is we set up a quick call. And then I get a little bit of information about you guys, just how you're organized, what are the names of, just things like that. And then I take that document and I carve it all up. And I cut it down to, okay, this is what I think you guys should have in there. And then I get that back because, yeah, it's a big document. And business continuity plans can get very really big documents. They can be 60, 70 pages by the time you're done with them. But that's kind of what I've been doing, just because my idea was to give you guys a template that gave you everything that you needed, and then from there we can carve it up based on your organization. Because yeah, some of this stuff doesn't quite fit directly into a really small health center, because in my experience, you might have a chief information officer, a CEO, and maybe a financial officer and a compliance officer. And then, and you won't have the big teams like that. So that's kind of what I've been doing. And so if that's something that you're interested in looking at, that's what we've been going forward and doing. I've done that a couple times already, and it works pretty good. Also, then I can take the document and add in more specific information to your clinics and addresses and things like that. And then you have a little bit nicer of document, a little less rough.
Okay, great. Thank you. Yes, I'll definitely review the templates and,
yeah,
And
I think your best bet would be is at the end here or towards the end week, if you put in one of those requests and then that will allow me to have some hours, and then we can start working together and see what you have and what we have and blend something together and go from there.
Okay, great. Yes, we've worked through a large part of this process, but your documents were very well organized, so I appreciate that. And I'm sure that we're missing, something, right?
Right. I mean, that's kind of the whole thing about business continuity plans. It's just constant re-looking and re-enhancement and iterations of the document, because everything changes. We think we know what's going on, and then something new pops up and we don't know what's going on anymore. So that's what I've seen. And the ones that I've seen that are really good go through that constant iterative process. Thank you.
Shelby, we have a couple questions in the chat. We have a question about how one would go about doing a tabletop exercise for a ransomware attack.
So, yeah, so you can look and find guidance on tabletop scenarios. Tabletop exercises can be a little bit difficult, especially for ransomware, because basically you're doing an assessment on what happens if your IT systems completely go down and you can't get into them. And so you can find, and I can see if I can't find any type of guidance on a scenario. And so you take the scenario and then you kind of walk through the scenario. There's a kind of a guide on how to do a tabletop exercise. It is quite involved. And so we can definitely look into, and I know that we've, Claire and I think are planning to do something like that in the future, aren't we?
Yeah, so I think we want to do it in person, so we're thinking early next year. So we're still in the planning phases of that, but we'll keep everyone in the loop of when we have something like that organized that people can participate in.
And it's kind of one of these things where it's you bring somebody in and they're like, okay, here's a scenario. You just had 25 computers ransomware. You don't have access to your EHR anymore. And then you guys work together and you're in a team to figure out, okay, how do we get past this? And then in the middle there, you have a mediator throw you guys problems. Like now you just got 10 more and you don't have access to this anymore. And so how do you get around that? And so you just kind of think on your feet And it's normally a really good exercise, and you normally learn a lot from it. Normally you learn that you're not prepared enough to deal with things like that. And I think that that's kind of a common thread amongst everybody, is that we don't really think about how hard these things can be until it actually happens.
Shelley, this is Dale Barker in the North Country, CP.
Hey, Dale.
How are you, sir?
Good.
I've conducted quite a bit of tabletop exercises through my previous employers.
Sweet.
So if this is something anybody needs a hand with, just let me know. We can work together on it.
Awesome, Dale. That's good. Yeah, it's one of those things that if you've done a lot of it, and you can speak up too, Dale, and say it's an interesting and a fun activity, but it is definitely kind of intensive.
We have another question in the chat. Going beyond cyber to operations, facilities, etc., is it advisable to break this down and get it to our different sites, then compile it into a master DR file?
Yeah, so I think that there's two questions there. You need to have a master business continuity plan, and to have it in one place, and a DR plan, so that you can pull that and say, okay, here's our master business continuity DR plan. But if you have individual sites that have different needs, what looks good in one facility probably doesn't work the same in another facility. So you might need to address business continuity in those other facilities. And a good example of that is business continuity in a 3-room satellite site is not the same as business continuity in a 100-room or a 200-room facility in the middle of the city. So I would say yes to both of those things. You need to have the main document, and then pull maybe an appendix for each individual sites if they need that, because they might have individual contacts, different people they need to call. They might have different, all the things are going to be different for them. It doesn't help them to call the fire department in the wrong part of the city at this. So there's going to be different numbers and things like that. That's one of the complexities of business continuity plans, is they are so very tailored to one spot in one organization. But at the same time, things like ransomware will be relatively the same, and internet outage will be relatively the same for your satellites, because a lot of them will connect directly into the main site.
Hi, this is Kevin from Evergreen Health in Buffalo.
Hi, Kevin.
Hi, I just want to make maybe a comment. I mean, I guess just saying that, we started small. It's easy to take off smaller chunks and start with your team. Tabletop exercises, the DR stuff. We started with our tech team and just said, let's talk through a scenario. And then one thing we noticed as well with the past 12 months that we all lived through, maybe it's 18 months now, I don't know what it is. People are more open to the conversation around tabletop exercises outside of the technology team, like the clinical team, facilities. There's more willingness to talk about it because disaster recovery is actually real now. It's always been, well, if the lights go out, or if by and by we get hacked. Now it's real because, okay, there was a pandemic and we had to really shift a lot of things, people and resources, to different places that they don't normally live, and deliver service in a different way. So the business continuity template, I thought it was nice to kind of go through that, just pick out chunks, start small. I think that's, and in healthcare, we're accustomed to the care plan, and it's a living document. I mean, I take the same approach with these disaster recovery and the business continuity template are just the plans that we have. It's a living document. It will change as our awareness increases, as the maturity of the organization increases, all of that. It's just little chunks. I guess that's my only comment.
No, that's a great point, Kevin, and that's kind of what I was alluding to, is that there's you get your team developed, and you get a few of these little things in place that are HIPAA requirements, and then after that, it's an iterative living document that builds on itself, and you know that there's certain things that there's a higher risk of happening, and ransomware is one of them. So focus on ransomware. You're never going to be unhappy that you didn't focus on ransomware. And to your point too, it used to be that pandemic was like out of 20 different things, pandemic was the last one, and everybody's pandemic, then that's the one that gets us, the one that no one thought about for 100 years. And so yeah, there definitely is, and that's why this has been a hot topic everywhere. I mean, you guys are doing it, but so's Montana, and so's Wyoming, and so a place, everywhere is doing this all at the same time, and it's just getting these documents, getting them moving, getting them in an iterative process so that there can be maturity happen in the document, and then in a few years you got this great document. That's great. Appreciate it. Other than that, there is, if you guys can still see it, there is a QR code there. And let me see if that works. Oh, oops. And I just have on here just a few components of incident response plan. And then that's it. And so there's evaluation part. We will get you this PowerPoint because there's a lot of good information in it.
Yeah, we'll send the slides, and we'll send the template. Well, in that email there will be instructions for how to request the individual assistance if you want Shelby to work with you on where your center should start or on any of the specific templates. If anyone else has no questions, we can give you some time back. And I see Alex also posted a sample cybersecurity tabletop exercise in the chat as well. So
awesome. Yeah, I didn't have that queued up, but yeah. And I do think that we'll be doing some of that stuff later on, maybe early next year. And they'll be live events. And we'll have a team of people from online running them that have done many of these. It's everybody that we've always done it with has really, really enjoyed it. And so that's a good thing to have done. And again, you can put requests in for services on did you send that TA request?
Yeah, we'll send that out as well.
And we can start digging through these templates a little bit. And if you need anything specific on guidance on any specific threat that is out there on how to handle anything like that, we can work on that too.
Great. Okay. Thank you. Thanks, Shelby. That was really helpful.
Yep. I'm sorry I didn't take up the whole hour, but everybody's like, that's fine. And I'll let you guys have part of your day back.
Cool. Sounds good. Thank you, everyone.
Yep.
Thank you.
Thank you.
Thank you, Shelby.
Yep. Thank you so much.